Thank you so much for that introduction. I'm really excited to be here. This is definitely something that is a little out of my scope. I am not a perfusionist. I'm not a doctor. As Ty mentioned, I'm just somebody who has been personally affected by addiction. And again, I'm really grateful for this opportunity to be here. I'd like to ask you to metaphorically put aside your degrees and just kind of spend some time with me today on a basic human level.
And basically begging him to tell me what happened. My brother's name was Hunter. My family jokes about it all the time, that they gave him a nickname of the mayor, because he could talk his way out of anything, and he was super charismatic, very thin, very handsome, athletic, very smart. He had it, he had the picture of a all-American family, nice kid. He was into sports and athletics, and I was into music. We were very different. And he started playing hockey really young, and he was really, really good. We were constantly going to Canada, and that was really exciting, watching him, be successful and be this athlete that my parents were so proud of. Big opportunity, and it was between, do I go to college in Arizona or do I go and do this big hockey training? And I think at that time he really wanted to have fun, which I understand, I get it. I know that my parents, I think my father was really disappointed. He beat himself up that he made a mistake. There were other kids that he played with that went on to play pro. I think he watched that and kind of was kicking himself, like, why didn't I take the opportunity? Arizona didn't work out. He got in trouble there. So he moved in with my mom to go to community college and kind of start over. And he did really well. He's going to school, he's getting good grades. And then I guess he made some friends and moved downtown. I saw him, he spent time with my son, which was wonderful. And I had this photo of him holding my son. It's the sweetest thing. So what I saw in real life versus what I saw in that photo, it's like night and day. I guess what was really going on actually translated in the photo, because you look at him and you see somebody who's sick and very unwell and definitely using some kind of substance. But in person, I didn't see it. It's hard, and I do beat myself up at how did I not know? I didn't really look at it for what it was. And he went home and we hardly spoke. And then I got a text message from my dad. It was very short. It was, just so you know, no one's heard from Hunter in a few days. I ended up calling the police station, and she put me on a long hold and came back on the phone and was like, I'm gonna need to speak with your parents. And that was kind of the moment that I knew something's not right. I remember calling my dad and basically begging him to tell me what happened. We had to go and clean out his apartment. I think that was the hardest part. It's so bizarre because on the outside, he was so put together. And my mom was in his house, I think a month prior to him passing away, and the house was spotless. What we saw, I don't know how he could have been living like that. And it was such a shock. How did this happen? And never a clue in the world that it was heroin. For him to pass like this, it was just a shock. And I'm sorry I didn't know. And I wish that we would have had more time together. It's hard to process, because all you can think about is the last moments, how much pain somebody has to be in to make a very, very permanent choice like that, it changed me. It changed me a lot. You know, when something like this happens and you realize like how fragile life is, you start to take a look at, are my relationships serving me? Am I serving other people? Like, you know, and I started to evaluate everything and be like, none of this is working anymore. I think it's really important that people understand there's nothing that anybody did, you know, to cause this. Like, he was suffering, you know, and he suffered in silence, unfortunately. So I think that's the main reason why I talk about it. The important thing is, like, you gotta check in on everybody. You don't know what's happening underneath. It was important for me to get into a role where I can use this pain and use the experience, not only to help other people, but to help myself.
Okay. No, it's funny because I haven't actually watched this video since I've been preparing for this presentation. I've kind of just scrolled through it because I've seen it so many times. But it's been a while since I actually watched it. And it brings me back to that place of that day when I got that news, you know, and I think that's the phone call that anybody who knows somebody struggling with any kind of substance use disorder or addiction, that's the phone call that I think as family members, we all are worried that we're going to get someday, you know, and unfortunately, you know, in this day and age and with what we're facing as a country right now, there's been quite a few people just within the last couple of weeks that I know personally that have either overdosed and passed or made the same decision as my brother to take their own lives. So this is not the easiest topic for me to discuss, and I know it's sensitive for a lot of people. And again, sorry about that. I'm not a licensed therapist. I'm not a doctor. I'm just somebody who's been through this, and I really want to reach an audience and be able to kind of promote some awareness. So I wanted to give you another quick visual. This is actually the home that I grew up in Hinsdale, Illinois. And I wanted to use this photo because I think it's pretty telling that it really doesn't matter how much money you have or how big your home is or what kind of job you have. Nobody is immune to the disease of addiction. You know, Hinsdale is one of those suburban Chicago towns that, by all intents and purposes, is the ideal location to raise a family. And it was safe and it had a small town feel. But it's also one of the many American towns where drug use actually runs rampant. And until pretty recently, people really weren't talking about it. It was one of those issues that was shoved under the rug and people were embarrassed. And that stigma that's attached to addiction is still very much an issue. In my day-to-day work, working with families of our patients, I still run into people who are extremely embarrassed of their loved ones having any kind of substance use or mental health condition. You know, when my parents went through this experience, when we went through this as a family, losing my brother, it almost felt like more so my parents than myself, but were essentially blacklisted from their community. I can't tell you how many different women I've heard, you know, my mom call me and say, you know, so-and-so's mother removed me as a friend from Facebook. And as silly and menial as something like that sounds, it's tough to feel like you're being ostracized from your community. Like, people have this concept or idea that addiction is contagious, so they can't be associated with our family because of what's happened, or they don't want to be associated because they don't want people to think that their kids who were friends with my brother had any kind of issues. And that's a really good example of what this stigma is doing to relationships and to our country and what's preventing people from getting help. So what is addiction? What does it actually look like? What kind of impact is it having on individuals, on our loved ones, on our communities and society as a whole? Addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control despite harmful consequences. It also means to actually be enslaved to. So people that are addicted to substances, they have essentially lost their freedom to choose. And there's a saying in Alcoholics Anonymous, they use to live and live to use. And the brain chemistry, as I'm sure some of you are familiar with, of somebody who's addicted to opioids can potentially be forever altered. It can take upwards of 1 year for the brain to fully repair and start to work on a cognitive level where they can make positive choices. And I've learned the hard way that we can't always take addiction at face value. Subconsciously, I think many of us might have a generalized stereotype of what addiction might look like. Ty was mentioning before, we might think that if we saw an addict, we would just know, but that's not always the case. Today, addiction is not just the homeless man under the bridge with a needle in his neck. It's affecting people of all races, all religions, any kind of socioeconomic background. It could be your colleague. It could be your friend, family member, or even your neighbor. More than 15 million adults in the United States meet criteria for alcohol use disorder. There's another 7+ million that struggle with drug use disorder. Addiction is a multifaceted issue that's going to take a lot of time and effort to be properly understood and addressed. I challenge each one of you to be objective here and to try to look at addiction with less judgment, with more compassion and more tolerance. I know this is a sensitive topic that requires support and understanding in order to promote healing, which is why I'm here today. Only then can we actually be on a path to recovery. And the US Surgeon General reported that less than 10% of those struggling with addictions have actually received the help that they need. There's no single factor that can predict whether a person will become addicted to drugs. It's a combination of genetic, environmental, and developmental factors that influence that risk. The more risk factors a person has, obviously, the greater chance that taking a drug could possibly lead to addiction. And I work with the families of our patients on a daily basis, and I've seen firsthand what effective treatment is able to do in order to combat addiction. And the treatment episode is essentially just the first stage in long-term recovery. Sustainable sobriety requires that the patient actively seeks and engages in their own recovery. Addiction is treatable and can be successfully managed with hard work. Okay. So 1 in 5 people aged 12 or older in the US reported the use of illicit drugs within the past year. That's an estimated 53.2 million people. 9.9 million of those reported abusing prescription pain meds, and close to 1 million reported heroin use. And collecting this kind of data is really important for us as providers to be able to see the effects of addiction on this country. And based on this data, and from what I've seen with working in the field, I'd have to assume that these numbers really might be on the low side, and I would possibly guess that they might be higher next year when this data is collected again. So opioids as a medical necessity, they are one of the most effective at treating pain. In many scenarios, they are essential. And I'm not coming here today to scream from the mountaintops, hey, stop, you have to stop prescribing opioids. That's not my message. I understand completely that they do serve a purpose. There are many justifiable reasons to use them. All I'm asking is that providers really be more aware that there is a direct connection between prescription opioids and the massive problem that we're facing in this country. We truly need to be more conservative with how and when we use these drugs. And I want to review a quick timeline of events to show kind of how we got to where we're at today. From 1999 to 2018, almost 450,000 people have died from an overdose involving opioids, and that includes prescriptions and illicit drugs like heroin. We've had 3 different waves of overdose deaths that have led to what we now call the epidemic. So we started back in 1999, and that was when there was the first real push for providers to start prescribing opioids to treat pain, the beginning of what today is a multi-billion-dollar industry. And pain management was really big in the early 2000s. I mean, opioids were being prescribed like candy, essentially. There was a pain clinic on every corner down here in South Florida where I actually live. They were super accessible, and chances are at some point or another, you've had them at home in your medicine cabinet. And then we had our second wave in 2010. And many prescription opioid users at this point had graduated to illegal substances like heroin. For a lot of users, heroin was easier to find and less expensive. The third wave began in 2013, and that's when we had heavy increases in fatal overdoses that involved synthetic opioids, particularly those involving illicitly manufactured fentanyl. And in 2014, there's data that suggests there were enough prescriptions written that year that every single adult in the United States could have their own bottle at home. The market for illicitly manufactured fentanyl continues to change. We're seeing it now in lethal doses, not only mixed with heroin, but counterfeit pills like counterfeit benzodiazepines and even in cocaine. Opioid use disorder has reached epidemic proportions in the US. This can be fatal with mortality rates tenfold or higher than in the general population. And again, I've been doing this for roughly 10 years, and I'm based down in South Florida. And this is a community that's oftentimes described as being one of the recovery capitals of the country. And many addicts seeking recovery end up here from across the United States. But despite all of the recovery resources and all the treatment centers and everything that's available here, the number of opioid-related deaths continues to climb. The CDC is calling the opioid epidemic a public health crisis now. And with that being said, I think it's really interesting to mention that you see what's going on with the coronavirus, and you can't turn on the news without having, if not most all of it, being just about the virus and how it's impacting this country. This epidemic with opioids and heroin use and overdose, this has been going on for years. And yeah, you are seeing some of it in the media now. People are starting to talk about it, but nowhere near the volume, as what we're seeing in today's situation with the virus. And I just think it's really interesting. And I know a lot of people in my field are having this conversation of, why isn't this as important? And granted, we're in the middle of COVID-19, and I'm not trying to discredit or take away from how important it is and how serious it is. It's just interesting. And I think a big part of that is stigma. And it's not just the actual overdose deaths that are killing people. The health consequences like infectious diseases, people are sharing needles and contracting hepatitis C, HIV. They're getting sepsis, and they're dying of even cardiovascular diseases. And I've lost my own sibling. And like I mentioned earlier, not only him, but friends, colleagues, associates. I've literally lost track of how many people in my life have passed away because of the disease of addiction. And again, the numbers are staggering. 450,000 people have died from an opioid overdose. The rate of overdose deaths has increased on an average of 16% since the year of 2014, and it's more than tripled since 1999 when these prescriptions started being handed out so easily. This works out to nearly 128 people every single day. So that means every 15 minutes, we are losing a life to the opioid crisis. So that means during this short period of time that I get to speak with you here today, we will have lost 4 people to an opioid-related death. And there's also been a steady decrease in life expectancy rates in the US. And tragically, this is largely driven by drug overdoses and suicides. And my hope is that most of you have not been personally affected by the disease of addiction, but with these odds, it does have the potential to hit a lot closer to home. And unfortunately, if you haven't been directly touched by this already, at some point, you probably will. So opioid use disorder is also pretty comparable to something that I'm sure a lot of you are pretty familiar with, type 2 diabetes or hypertension, in that they both have genetic, environmental, and behavioral factors that are at play here. And both diseases require lifelong treatment to keep it in check. And just like insulin is used for a diabetic patient, there are different treatment modalities used for someone suffering from addiction. We've got medication-assisted treatment that's often used, or 12-step support are used on a longer-term basis to keep cravings in check and support recovery. Opioid use disorder, like diabetes, is a chronic disease that requires treatment, and it doesn't just go away. You can't just will yourself out of addiction or alcoholism. If it were that simple, there wouldn't be all these drug treatment programs and people that are staying in 12-step fellowships for the rest of their lives. You know, there are layers to treating addiction, medically and behaviorally, and one can't really exist without the other. So many people who are struggling with substance use disorder have experienced some sort of trauma in early childhood, and trauma really can vary from individual to individual. So what might be defined as traumatic for me might not be true or be traumatic for you or the next person. The way that we're raised, our childhood events essentially mold us as human beings and can often leave us predisposed to substance use disorder. And many treatment programs, including Banyan treatment centers, are tackling co-occurring disorders today. And we find that patients are often self-medicating for mental illnesses. And this ranges anywhere from general anxiety disorder to more acute cases like schizophrenia. So when we're talking about addiction and substance abuse, we have to talk about the mental health in the same space. And heritability of substance use disorder is estimated to be greater than 50%. So family history is a really strong predicator in the disease. And my father was actually adopted when he was an infant. And when we actually look back to my paternal family history, there were multiple older generations that really suffered with alcoholism, which very well could have left my brother and even myself predisposed to substance use disorder. So there's a lot of myths surrounding addiction and recovery. One of those is that addicts have to hit rock bottom before they can get better. Rock bottom, in my opinion, does not look the same for everybody. Early interventions are not only effective, but necessary in a lot of cases. So recovery can begin at any point in the addiction process, and the earlier, the better. The longer drug abuse continues, the stronger the addiction becomes, and the harder it is to treat at that point. We don't want to wait to intervene until the addict has lost everything. And I, for one, would rather not wait around to watch somebody die. I personally believe that it does not have to get worse before it can get better. And then there's a myth that you can't force someone into treatment. They have to want help. I work with the families, a lot of them who are pretty hesitant to push for treatment, especially if their loved one has recently relapsed, because they believe their loved one doesn't want help. And treatment doesn't have to be voluntary to be successful. People who are pressured into treatment by their family, their job, the court systems are just as likely to benefit as somebody who enters on their own free will. I often tell people, you never know when that light bulb is going to turn on and somebody has the willingness to want to recover and to seek change. As somebody sobers up and their thinking clears, many formerly resistant addicts decide that they want change. And I just wanted to touch on a couple of the more obvious telltale signs or abnormal behaviors. You've got withdrawal from activities that somebody normally enjoys being a part of, isolation, overall changes in attitude or personality. And as medical providers and people working in the medical field, you have an opportunity to identify issues and promote recovery and hopefully incite some change before things spin out of control. So last year, the United States Preventative Services Task Force announced the draft guideline that recommended screening of all adults over 18 for illicit drug use. And clearly, the illicit use of substances is more common than we might think. And this last decade has been the worst epidemic we've ever faced as a country. So it's imperative to be screening all patients for substance use disorder. Only a fraction of individuals who need specialty treatment for drug or alcohol addiction are actually receiving it each year. And it's a really tough environment for people who are seeking help today. So just opening up the conversation and asking a few simple questions could be enough to lead someone to seek treatment. screening. So again, as medical providers, you are very important figures in your patients' lives. In a very short conversation, you have a great opportunity to let your patients know if and how their drug use may be putting their health at risk. So there's 5 A's of intervention. We're asking, advising, assessing, assisting, arranging. And this can be a really useful framework for screening and providing feedback related to drug use. So when we ask, we're asking one or more questions related to their use. First question is usually something along the lines of, how many times in the past year have you used an illicit substance or prescription medication for a non-medical reason? And a response at least once is a positive screen and really should prompt some further assessment. Advice is involving strong direct personal advice from the provider to the patient to promote change if it's clinically indicated. And this is your opportunity to really build rapport with your patient and encourage them. You can recommend quitting before more problems develop and give specific medical reasons, like what kind of health risks they're putting themselves at by using whatever the substance is. And then assessing, it's really important to take a look and figure out how willing a patient actually is to change his or her behavior after hearing your advice. Assist is when we're helping them make a change if he or she appears to be ready. And then arrange is after further assessment. If it's appropriate, we try to set up follow-up appointments. It's important for medical providers to have a strong list of trusted treatment providers to provide to patients who need specialty treatment for drug or alcohol, or even primary mental health treatment. So these are the more obvious physical symptoms. And this brings us back to, I would just know, somebody whose physical appearance has deteriorating, personal grooming habits have gone out the window, bloodshot eyes, very small pupils, larger pupils, changes in appetite or sleep patterns, sudden weight loss or weight gain, tremors, slurred speech, or impaired coordination. And as I mentioned earlier, the stigma surrounding addiction is really the driving factor in what keeps a lot of people sick. And to review, addiction is a chronic brain disease that affects millions of people. It's no different than heart disease or cancer. And scientists actually originally started to study the disease concepts of addiction because people who struggled with this were thought to be morally flawed rather than having a health condition. And because of this, these people were essentially punished rather than being treated. And in turn, that brought a powerful stigma for people with the disease addiction. So for somebody struggling with substance use disorder, being faced with their own issues can be frightening, and there's usually some form of denial present. And there's no shame in having heart disease or cancer. The same should apply for addiction, because that shame related to the stigma is what's keeping people from getting the help they need. And I can tell you one thing, there's nobody that wakes up in the morning and says to themselves, you know what? I'm tired of having a happy, healthy, normal life. I think I want to grow up and be a drug addict. And I truly just want to destroy my life and ruin my career and turn my family against me. I want to go to jail. I want to carry a felony with me for the rest of my life. Nobody wakes up or has that kind of dream as they're growing up to be a drug addict. It's not really a choice. It's an uphill battle, and it's one that's really difficult to navigate. The fear of being stigmatized is one of the most common reasons, again, that individuals or families don't seek help. So when we're removing that stigma, we're essentially opening up a space for people to feel comfortable enough to ask for help. And opening that dialogue alone can be truly life-saving. Not only does this stigma prevent them from seeking help, but it's also been shown that they are more likely to leave treatment earlier against medical advice. So if you know somebody who's suffering from opioid abuse, alcoholism, or any other addiction, just talk to them about it. Simply talking about it removes the stigma associated. So we're starting a dialogue, and the most important factor in opening a discussion about addiction is ensuring the feeling of being safe, protected, and supported. Building a strong rapport with somebody who is struggling is crucial. We want to let patients know that there are resources available and that they are able to ask for help. we're providing information, and this can include education on addiction and mental health issues, as well as a list of resources for treatment centers or different individual providers. We offer support. We're engaging patients in a non-judgmental way. I think this is the most important piece. It's coming from a place of care and understanding. If an individual is feeling judged or less than, they're A, probably not even going to hear what you have to say, or B, they're not going to be willing to get honest about their behavior or even admit that they need help. So we want to practice avoiding using any tone of voice that might cause a patient to feel judged. We want to show interest in what their life is like, meet them where they're at. We can acknowledge that their current view of his or her drug use, what that looks like, and that's what it is for them. But we can also shed light on some of the potential health risks that could be if they don't make any changes. We want to let them know that it's okay to have mixed feelings about a substance use problem, and obviously highlight patient confidentiality and remind them that they're safe speaking with you. Use person-first language. So etiquette is really, really important. We want to avoid fear-based language, words like scary or terrible or even major problem. These are all just reinforcing the stigma all over again. We want to avoid language with an accusatory tone. So we're not painting addiction as something a person should be blamed for. And then focusing on building a community. We want to avoid any kind of language that describes those struggling with addiction as outsiders or those people. Please encourage your colleagues to consider their own language and behavior towards those struggling with addiction. Set the precedent that negative talk and actions towards those struggling with addiction are not acceptable and may be harmful to the individual as well as your organization. I accepted this opportunity to come and speak with you here today so that I could ask you all to become advocates. Please bring your advocacy to your patients. Just letting somebody know that you care enough to take the time to explore these issues could potentially save a life. So today, I currently work in the substance use and mental health space by helping families through the process of treatment and through the first year in their recovery. In 2014, I had been working in this field about 4 years, and I made the decision to take a break from the industry when I gave birth to my son. This is a career path that is definitely not for the faint of heart. And at that time, I really wanted to give all of my energy to my son and to being a homemaker. And then when I lost my brother, I felt compelled to get back to work. I felt like I had to help those that were affected by this issue. And not only opioid abuse, but we're talking mental health. My brother committed suicide. And if I could help one family avoid going through what we went through, my work would be done here. And I just felt like I couldn't sit at home anymore and watch this continue to happen without feeling like I was reaching my hand out to try to make a difference. And Hunter was one of those people who never sought professional treatment. I believe that he was extremely plagued with the stigma here. I think he was ashamed. He was too embarrassed to speak up, to tell even myself. And he knew that I had been working in this field for quite some time. If there was somebody that he could feel safe enough speaking to, it should have been me. But he was too embarrassed to even come to me, about his addiction and asking for help. He never went to a treatment facility. To my knowledge, I don't think he's ever stepped foot into a 12-step meeting. And again, this is the driving force of why I'm here today. It's just so important for me to be able to talk about the effects and how crucial intervention is, and hopefully shed some light and be able to help some people. So I work for an organization called Banyan Treatment Centers, and we are actually a national treatment provider. We've got about 11 facilities across the country, and we recognize that addiction is a family disease. So we need to treat the whole picture, not just the individual that walks into the facility. So we provide a comprehensive family assessment after admission. And this is really just to gather collateral information and better understand how to support this specific family through the process. And we offer a number of different resources, anything from family sessions, either on Zoom like this or by phone. We do weekly family support groups. We offer a family workshop and a family weekend. And each family has a different journey. So we're really customizing exactly how we're educating these people, supporting them and finding their own recovery. You know, what works for family A really might not work for family B. A lot of people really enjoy, let's say, peer support with a fellowship called Al-Anon, which is pretty similar to Alcoholics Anonymous for those of you that aren't familiar with it. It's essentially a support group and program that's structured the same way as Alcoholics Anonymous for the alcoholic, but it's for the loved one of the alcoholic. And it's been a really effective form of support, you know, and I encourage that for a lot of families. And I'm fortunate enough to work for this organization where I get to offer that kind of support and education. You know, this is information that my family, I believe, really could have benefited from had we known more and seen more of the signs. And my mission here is, if I can just prevent one death or help one family walk through this, or help anybody seeking recovery to find it, you know, that's all I could really ask for. And I wanted to mention real quickly just about, again, with this COVID-19 pandemic, it really is a fuel for the fire that is opioid addiction and this epidemic as a whole. They say that the opposite of addiction is connection. And this virus has put a lot of people in recovery in a place where they are completely isolated. So people are really struggling. And even people that don't have any kind of substance use disorder, I think the effects as far as mental health are concerned, they're starting to show. And it's really tough. You know, we're getting calls on a daily basis from people who've recently relapsed, are struggling to stay on track. And with all of this fear and anxiety, you know, that we're facing as a country, it can be crippling for somebody who's simply fighting to stay sober for another day. So I'm just grateful today to have an opportunity to be on the front lines helping these people. I'm also really grateful for the opportunity. And Pi, thank you so much for inviting me here to share my experience with all of you. I will open up for if anybody has any questions or concerns or anything they'd like to bring to my attention. Thank you so much.